Hi, my name is Max with the Southwest Care Outreach and Prevention Program. Today we're going to talk about how to use Narcan. You're going to want to use Narcan if someone is overdosing on opiates. So you'll want to think of the ABCs to recognize this. You want to see if they are asleep, unconscious, or unresponsive to stimuli. You will want to see if they have blue lips, nails, or face. You want to check for choking or gurgling, or if they are not breathing. If you think someone has overdosed, first thing you should do is call 911, and then you should administer naloxone with the 3 Ps in mind. Peel off the packaging. Place the tip of the nasal spray in either nostril of the person overdosing. Then push down the plunger to release the dose of medication into their nose. Then you should wait 2 to 3 minutes for the person to respond. At that point, the person should start waking up. Try to keep the person awake until EMTs arrive. Find overdose prevention and naloxone in New Mexico at nmharmreduction.org.